Welcome back, warriors. Kwe Tansei Seigo. Hi, my name is Pam Palmater, and welcome to my YouTube channel where we focus on educating the resistance and inspiring the next generation of warriors to help us save our peoples and the planet. I cannot believe that federal and provincial governments have yet to come together to work and come up with a comprehensive First Nation decarceration plan to prevent COVID-19 outbreaks in all of Canada's jails and prisons. There is no worse place than prison for Indigenous peoples to be on a good day, but to keep them captive there during a pandemic is absolutely inhumane. So stay tuned to hear more about what governments can do to prevent a disaster in prisons. Long before the COVID-19 pandemic hit Canada, Canada was already in the midst of a human rights crisis that has been ongoing for decades. The justice system discriminates against First Nation peoples in very targeted ways, from police to judges to corrections. First Nations people are over-policed, arrested more, overcharged, all in comparison to non-First Nation peoples. They get harsher sentences, spend more time in prison, and are less likely to get parole. All of this is due to racism against First Nations people, historic and ongoing. There are nearly 39,000 people in federal, provincial, and territorial custody on any given day in Canada. What is astounding is that there is far more people in remand than in sentence custody by a huge amount. The latest study shows 14,000 people in provincial and territorial remand and 9,500 in federally sentenced custody. That means that the majority of people sitting in prison right now have not been convicted of the crimes of which they have been accused. Many jails and prisons in Canada are notorious for overcrowding, lack of cleanliness, and a critical lack of access to health care and mental health care. This means that by far they are some of the worst places to be during the COVID-19 pandemic, and all levels of government know this, but they have been exceptionally slow to respond to the threat to prisoners from this pandemic. We have to remember that there is no death penalty in Canada, but by keeping people incarcerated, they risk an outbreak in prisons that could kill both prisoners and staff. It is so important that we take public safety into account, but many prisoners have not even been convicted of their alleged crimes, nor are their crimes of violence where public safety might be an issue. We also have to consider exactly who is occupying Canada's jails and prisons. We know from the statistics that First Nations people are incarcerated at crisis-level rates that continue to increase year after year. The John Howard Society, which advocates for male prisoners, and the Canadian Association of Elizabeth Fry Society, which advocates for female prisoners, have been trying to get governments to take action to address this gross injustice for First Nations for decades. Various human rights organizations like Amnesty International, the Feminist Alliance for International Action, and First Nation advocacy organizations, grassroots community groups, and frontline workers like on Vancouver's downtown east side, together with Indigenous experts and advocates like Sharon McIver and Al Jones, as well as experts and allies like Senator Kim Pate, have been doing everything in their power to advocate for changes to legislation, policy, and correctional practices. We've even traveled to various United Nations human rights treaty bodies in the hopes that their recommendations to Canada would result in substantive changes and a decrease in First Nation incarceration rates. And we're not alone in seeing that the over-incarceration rates are an urgent crisis. The Supreme Court of Canada, in the Gladue case in 1999 and reaffirmed in the Ipili case in 2012, both acknowledged a serious problem of over-representation of Indigenous peoples in Canadian prisons, and they gave specific directions to the lower courts to consider alternatives to jail and prison for Indigenous peoples in order to address the crisis. The Gladue case was more than 20 years ago, yet Indigenous incarceration rates have continued to skyrocket. Even Canada's own Office of the Correctional Investigator, who is the ombudsperson for federal prisoners, has raised the alarm about First Nations over-incarceration for nearly 2 decades. Their reports have explained that this crisis is not about First Nations being more criminal than Canadians. It is in fact about racism, discrimination, and injustice at every stage of the justice system. The Correctional Investigator reports have described the crisis over these many years as follows. 1999, unchanged, unacceptable, and discriminatory. In 2003, the discriminatory treatment is a continuing crisis and embarrassment. In 2004, discrimination against Indigenous peoples is so bad there should be an independent review. In 2005, grave systemic discrimination prevents Indigenous peoples from enjoying their statutory and constitutional rights. In 2008, the persistent pattern of disadvantaged outcomes and inequitable results stemmed directly from federal policies. In 2009, various recommendations would have made things better, but have not been implemented, and that has resulted in the deteriorating situation and the gap widening between Indigenous and non-Indigenous offenders. And in 2010, the inequitable and differential outcomes are the result of federal correctional policies and practices. This is a pretty damning assessment of how Canada treats First Nations and how Canada's own laws, policies, and practices have put Native peoples in prisons and have kept them there longer. Ivan Zinger, the current correctional investigator, released statistics in just this past January that shows the stark increase in the number of Indigenous peoples in prison, from 17% in 2001 to over 30% in 2020. And the situation is even worse for Indigenous women, who now represent more than 42% of those in federal prisons. Nearly half of all youth admitted to youth corrections are Indigenous. Yet Indigenous peoples only represent 5% of the Canadian population, and provincial rates can be much worse. In Saskatchewan, 75% of prisoners are Indigenous, and Indigenous boys represent a whopping 92% of those in youth corrections, and Indigenous girls, 98%. And the rates in other provinces like Manitoba are very similar. How can Canada continue to let this happen? It is clearly a gross violation of human rights, and according to the National Inquiry into Murdered and Missing Indigenous Women and Girls, it's one of the many ways in which Canada continues genocide against Indigenous peoples, but especially Indigenous women. Every successive federal and provincial government has failed to take substantive legislative and policy measures that would address this crisis. Now, all of their collective failures to act may well exacerbate the new crisis facing Canada, the coronavirus pandemic. Like I have explained in my last few videos, we know from past outbreaks, epidemics, and pandemics that First Nations suffer higher rates of infection and death. During H1N1, Indigenous peoples made up 28% of all hospital admissions during the first wave, and 18% of the deaths, despite being only 4% of the population in 2009. The majority of those were First Nations. And in Winnipeg, Manitoba, 55% of admissions to the Children's Hospital were Indigenous kids. Multiple generations of assimilation, oppression, and dispossession have all resulted in severe socioeconomic conditions, higher rates of infection and chronic diseases, and otherwise poor health in Indigenous peoples. And these poor health outcomes compromise Indigenous health now and make them far more vulnerable to pandemics. If you look at tuberculosis, for example, that's a highly infectious disease that has relatively low rates of infection amongst Canadians. But First Nations suffer rates 40 times that of Canadians, and the Inuit 290 times. These health conditions are all exacerbated in prisons, where access to health care is lacking and where the virus, the COVID-19 virus, has now taken root. These kinds of health conditions for Native people are all exacerbated in prison, where access to health care is critically lacking and where the COVID-19 virus has now taken root. A guard at Toronto South Detention Centre, one of the largest urban jails in Canada, has reportedly tested positive for the virus. 5 prisoners have tested positive for COVID-19 at Grand Valley, Canada's largest prison for women. Joliet and Port Cartier prisons in Quebec and Mission Prison in BC have prisoners who have also tested positive for COVID-19, and that's just the federal system. We also know that a prisoner has already tested positive for COVID-19 in Okanagan Institution, BC's largest provincial jail. An outbreak of the virus in Canadian jails and prisons puts the lives of prisoners at significant risk, which means that the lives of First Nations are even more at risk. More than 90% of Indigenous women prisoners have been gravely impacted by physical and sexual abuse even before coming to prisons. More than 1/5 of Native prisoners have been impacted by residential schools, and about 2/3 of them have already been impacted by the foster care system. It is bad enough that these prisons have essentially become the new version of Indian residential schools in modern times, but it is unacceptable to condemn First Nations people to a death sentence, especially knowing the disproportionately poor health that they have before they even get to prison. There have already been calls by others for urgent decarceration strategies to prevent an outbreak in prisons. The union representing legal aid workers and staff in Saskatchewan has already asked governments to release low-risk, non-violent prisoners on the grounds that an outbreak would threaten the health and safety of prisoners, staff, and local hospitals. Similarly, the League of Rights and Freedoms also called on the Quebec government to reduce the prison population to avoid the virus spreading like wildfire. Some steps have already been taken in this direction, but not nearly enough, and not in an urgent, coordinated fashion that takes into account the gross over-incarceration rates of Native peoples, but especially the high rates of Indigenous women and youth. In Ontario, some low-risk prisoners are being released early to help stem the spread of the virus in that province's jail, and some prisoners have been released to house arrest in provinces like Alberta. Newfoundland and Labrador's Justice Minister has also indicated that that province is considering temporary absences for prisoners during the pandemic, arguing that jails are literally petri dishes for the spread of the virus, and that it could spread like a, quote, crashing avalanche if the government doesn't act now. A targeted decarceration plan for Native peoples, especially Native women who have the highest incarceration rates in Canada, would be in line with recommendations from the European Committee for the Prevention of Torture and Inhumane or Degrading Treatment or Punishment. They recommend alternatives to prison, including commuting sentences, early releases, probation, and release into community care. United Nations Human Rights Chief Bachelet explained that many prisons are dangerously overcrowded with unhygienic conditions and with inadequate health services. She urged governments around the world not to neglect prisoners because that would be catastrophic during this pandemic. She also called for the release of political prisoners and those who present low risk. And she also called on countries who are threatening to use prison for those who don't respect pandemic measures not to do that, that is something that would make matters worse and overcrowd prisons even further. When First Nations started raising serious concerns about the pandemic in the early days, Indigenous Services Minister Mark Miller promised that no Indigenous community would be left behind and that the federal government would address vulnerabilities, explaining that there is a need for special support and special care for Indigenous peoples. Yet, for all these promises, we have yet to see a comprehensive plan that includes one to decarcerate Native men, women, and youth, especially those sitting in remand. An Indigenous decarceration plan should have been developed long before this pandemic, but should at least be included in a federal, provincial, territorial, and Indigenous government pandemic plan. Decarceration is not about opening prison doors in the middle of a pandemic. This is not about releasing serial killers or other people who pose a significant threat to public safety. We know that there will be some people who should be released and some who will likely remain in prison for public safety. And not everyone agrees with that. There are prison justice activists who think that everyone should be released from prison, and some who think only a small number of low risk. I think the solution lies somewhere in between. Surely Canadian governments and Indigenous governments, together with human rights experts, can get together and come up with a really valuable strategic approach that properly considers the rights of Indigenous peoples that are incarcerated in prison and the need for public safety. In other words, there needs to be a planned approach that considers public health and safety while not perpetuating systemic racism in the justice system or increasing health risks to Indigenous prisoners, especially Indigenous women. Prison should not be a death sentence. Which raises another really important point. Indigenous prisoners are far more likely to be classified at higher risk levels due to systemic racism, so any assessment of the risk level of prisoners to be released would have to be done in partnership with independent prison justice experts and Indigenous experts. According to prison justice advocates, the majority of Indigenous women in prison don't even present a threat to public safety and should be released. Further, while some Native prisoners have homes to return to, many will require social supports for themselves, their families, and their communities on and off reserve. They'll need a basic income, housing, and health supports during their initial period of self-isolation, which will be required upon release from prison. Days matter in this pandemic. We have been calling for urgent action to address First Nations people in prisons for weeks now. Urgent action is required right now. Federal and provincial governments must come together with Indigenous governments and develop a decarceration plan with health and safety supports. I can't believe we are still trying to pressure governments to step up and prevent massive infections and the deaths of Native people in prison. Come on, Canada! Thank you for watching this channel. I'll post an article I wrote about this for APTN in the description box below, as well as some other publications and resources that may help educate on the issue. Please join us in pressuring the government to take urgent steps now. If this is your first time here, please also consider subscribing, commenting, and sharing these videos with your family, friends, colleagues, and social justice allies. If you want additional resources, you can check out my website at www.pampalmater.com. I wish you all health, safety, and shelter for you, your families, and our nations while we continue to advocate for our brothers and sisters all over Turtle Island. Till next time, stay alert, warriors. We need every single one of you right now. Woefully.